in managing your prescriptions and the advice that the pharmacist can give on your medication. He'll also touch uh, on when you see the doctor, you know, when you have to see the doctor and when to seek advice from your pharmacist. And also, for those interested, he'll touch on the benefits of medical marijuana. I think I've spoken enough. Akil, over to you. Thank you. And correct me if I've, erred in any one of these introductions.
Assalamu alaikum to all. Thank you, Shabir Bhai. Thank you, Nazmul Bhai, for the invitation to come and present to you folks today. Thank you for those of you who have chosen to give up your Sunday afternoon to join in on this talk. I want to wish you all Kushiali Mubarak, first and foremost. Uh, and I hope that you will remember all of us in your du'as tonight and all of our marhooms as well. Um, it gives me a lot of pleasure to be here and spend the next few minutes with you talking about the variety of things that we have picked for you today. Basically, I want to talk about uh, medication management and what your pharmacist can or cannot do, and the expanding scope of practice of pharmacists in general. What we're seeing is pharmacists are expanding their scope, meaning in simple language, they're allowed to do a little more by the variety of different provinces, the states, and also in the UK. So you see things, patients are leaning more towards their pharmacists. As we look at the last year, we see the pandemic that has hit us, and you will see that pharmacists have been open and they have been available. So we get a variety of different questions about medications and about life in general, about vaccines right now that do come up from time to time. So with that in mind, let's go to slide 1, if you would, please. So I want to talk about this subject matter by starting a poll on the audience that's here today. So I want to talk about medication management, right? And with that, I want to focus in on medication adherence and medication syncing. Medication adherence is a big word, right? But to simplify it, basically means taking your medication, right? As you discussed it with your physician. So here, the poll questions are, what is medication adherence? Taking all your medications every day, taking the correct amount of medicine at the proper times as agreed upon with your physician, and taking medications when there are symptoms to decrease discomfort. So basically, that is at the poll. And without wasting too much time, we see that 78% of folks, if we go to the next slide, um, the answer is in concert with the audience today. So I applaud you. The answer is B, taking the correct amount of medicine at the proper time as agreed upon with your physician. Now you see we focus about as agreed upon with your physician. So in the olden days, the focus was the physician told you what to do and basically you did it. But now we work on things as a team where you discuss things with your physician, you talk about it, we discuss the problem, and then both the physician and the patient decide why is the medication good for them, why is the medication being prescribed, what is the ailment, and then proceed from there. And that's where the pharmacist would come in, where you would then present that prescription to the pharmacist, and then the discussions happen after that. If I go to the next slide, it talks about compliance and adherence, right? So Shabir, if you could take the poll results that's on top of the slides, then that would be great, because it's superimposed right now on the slides, the results of the poll. Okay. So this slide, if you can see it, I know the poll results are superimposed on the slide. So here we're talking about compliance versus adherence. Compliance meaning basically as you're directed to take the medication, right? Or as decided by the physician. So compliance is an older terminology here, and adherence is that terminology where you talk about where you and your physician talked about it together and discussed it and then decided to continue taking it. The cost of non-adhering or not taking medications as discussed or as agreed with your physician are fairly significant. These are crazy numbers, and you can see I have a resource there as well. $4 billion almost. 10% of hospital readmissions or admissions are as a result of non-adherence. 5% of visits to the physicians again are as a result of this concept. You know, it's something that a lot of times we don't think about, but unfortunately it exists, and it is a serious problem. So here are some numbers that will tell you why I picked this topic, right? You're wondering, why did Akil in medication management, adherence, why is he talking about this? It's a significant thing. And as we go down this program, right, this presentation, we will actually discuss it further to see why this thing is an issue. Okay, next slide, if you would, please. So extent of non-adherence, right? So the problem with let's say there was 100 prescriptions written by a physician. About 50 to 70% of them will actually show up at the pharmacy level. So now we started with 100, and let's say for argument's sake, about 70% of the prescriptions show up at the pharmacy. Off that, right, 48 to 66 approximately get picked up. So let's say 60 of them get picked up. Then you break it down further, and as you can see, 25 to 30 will be taken as directed, right, or as agreed upon is a better way of saying it, with your physician. And by then, you know, you would have had a discussion with your pharmacist as well. So you see, now the numbers, we started with 100. Now look where we are, 25 to 30, right, that are being taken properly. And taking properly also, we'll discuss that, we'll break it down further. So you see 25 to 30 end up being taken properly. And then now they're taken properly. And then now what happens? We want to look at the refills, right? Let's say, because initially, if you reside in the province of Ontario, initially for a new medication, you may get a 30-day supply. Or a lot of times the doctor may say, you know what, I'm going to start you off on a antihypertensive or a blood pressure medication, simply put. But I want to see you in 30 days, right? Because we want to see how that medicine is working for you. And then we will decide whether to continue at the same dose or to creep up the dose a bit or to cut it down a bit. So this is where the refills come in, if you would, right? So here is the opportunity for refills, and you see where we started from and where we are. Hence the significance of this subject matter, if you would. Now we go to the next one here. This is, again, another poll. Why is it important to take your blood pressure medications? Decrease A, blood pressure to a normal range. B, minimize symptoms caused by blood pressure. C, prevent complications such as a heart attack or stroke. Or D, all of the above. So if we could have that poll up, Shabir or Nazmul, and see what the answers are before you go to the next slide. So we take a few seconds, if you would, to get some answers up here. I like the answer so far. Amazing. I want to get everybody a chance to respond, right? So that would be amazing. Take a few more seconds, right? See if there's anybody else that's left, right? So here we are. Okay, so majority of the respondents of the poll, right, at 84%, are agreeing with the next slide, which is basically all of the above, right? You want to maintain the blood pressure, right, at a normal level, right? You want to minimize symptoms like uh, hypertension, for symptoms of hypertension like stroke or heart attack, headaches, right? So that is B as well, makes sense. C again, complications of hypertension, stroke, right? We all know one of the most common effects, right? So again, D would be the answer here, the importance of taking these medications as discussed with your physician. So now let's look at, thank you for participating in that poll, right? Let's look at the reasons why people feel like they don't want to take the medications from time to time. We see a variety of reasons, right? And again, I have my resources down there, right? But if you look at this, um, I'm feeling good. I really don't need it. I don't think I need this medications. I don't need them. The second question we have, the answer is I have trouble remembering when to take my medications. I forget to refill prescriptions and run out of medications. So again, we talked about in that previous slide, when it came time for refills, if you would remember, we were down to 15 to 20. So here's that being reflected in this slide here. You see that folks forget to refill their prescriptions. Aha, here's something that I encounter daily. My medications cost too much, right? So my insurance will only pay 70 or 80% or 50%. Akil, what can you do about the rest of the copay, if you would, or they cost way too much, or they are not covered by my plan, or they are not covered by the provincial government plan, right? Something that we as pharmacists deal with on a daily basis. My drug regimen is extremely complicated. I'm on multiple medications, and I really do not know how to handle these medications. So my regimen is quite complicated. I need help there, right? So better than asking for help, I'm just gonna stop taking these medications, right? I feel better when I'm not taking them, right? Now, we look at hypertension, for example. When I remember when I went to school, which was a long time ago, one of the ways our professors described hypertension is a silent killer, if you would, right? So it's something that you may not know that's existing, right? Unless you get a minor headache or you have a blood pressure monitor at home and you monitor it, then you figure it out, or you go down to your physician and that comes up, right? So all these are some of the reasons that we run into while folks will not take their medications. But this is where the pharmacist can come in, and hence the subject matter today is to see if we can raise awareness about medications and the cost implications of not taking them as prescribed, right? So now we go down to, again, we talk about pharmacists and their role, right? If you would, with the next slide, the role of the pharmacists in hopefully driving medication adherence and doing a little better job of helping their patients take their medications on time, right? So one of the things we talk about, and a lot of times we see this, is talking about the actual medical condition. A lot of times when before we give out a medication, we'll say, what brings you to your doctor today? So these are open-ended questions, right? That we will say, why did you come visit your doctor today? Or, I've been monitoring my blood pressure, or I've been extremely thirsty, or I've been going to the bathroom very often, and I had to get it checked out. So I was here a few weeks ago, and the doctor did some blood work. And today, here we are. We have all the results. And I'm here today with my doctor, and he thinks that I have diabetes. My fasting blood sugars have been over a certain amount at fasting. My A1C has been above 7, right? And I'm here to visit my doctor, and we've decided that I need help. That I've tried everything that I could, I did try. I promise you, I did. I took my doctor's advice. I started dieting. I cut down salt in my diet. I increased exercise, right, in my regimen. I started walking, right, 10,000 footsteps, and a variety of these things. I did that, but my doctor said there's family history as well, right? There's something called family history. There's something called sedentary lifestyle, right? So these things that I cannot really work on, like family history is key, right? There's nothing we can do about that. So I'm here today. Now I'm starting on this medicine for this reason. So that's where your pharmacist would come in and say, aha, okay, I see why you're here. So your doctor has prescribed something called a water pill, right, which will help get rid of extra water in your body. And we call it a diuretic, obviously. But now this diuretic, right, needs to be taken a certain way. We need to look after certain things. And here are the side effects. One of the common one is it makes you go to the washroom, for example, if it's a diuretic for, let's say you're taking it for swelling in the ankles or hypertension, right? So it helps you get rid of that extra fluid in the body, but then you want to take it a certain way. So that's where the third point comes in, how to administer, right, the medication. So you want to take it in the morning, so that when you take that in the morning, the odds are better for you. Like right now, I just had a call before I logged in here, and somebody asked me, Akil, I'm feeling dizzy in the daytime with this certain medication that I'm taking. Well, that medication is designed to be taken in the evening, so that aspect of dizziness does not interfere with your day-to-day activities, so that if you take it at nighttime, then you're able to deal with the dizziness because you're able to sleep it off. Then there's the issue of how to minimize side effects, right? So we look at that, how to minimize side effects, like again, going back to the example of the diuretic, for example, if we're still sticking with that example, we look at diuretics and you see the concept of potassium declining. So you look at the different things that are there in the body, you want to maintain that equilibrium, and some electrolytes need to be obviously maintained, some like sodium, some like potassium. So in the case of this diuretic that we have picked, you see the decline in potassium. So what do, right? So you look at the options that are available for that potassium that is lower. And guess what? Bananas is right one of the options. From time to time, I'll actually look at this book here, if you can see it. This book talks about the medicines of the prophet. A lot of times I look at the things that when we didn't have the option, so look at what was available naturally. So potassium you can get in bananas, and then guess what? Dates is also a source of that, right? Then you look at how to minimize side effects, right? Again, we talked about that. How do you go about minimizing the side effects of medications? And again, we talked about taking something at night, something in the morning, reinforcing the importance of medications, right? So here we are today, we're talking about just that. Why is it important to take that medication? Because in this case, for example, again, sticking with the diuretic or the water pill, we let's say there was swelling in the ankles, and this was prescribed for that reason or for hypertension. But in this case, let's say it was prescribed for that reason. Then again, we want to make sure that you reiterate that. Now, again, as a pharmacist, I do not have an MD behind my name, but a lot of times we will work very closely with our doctors next door. And some of us have also access to their EMRs, which is the medical records, electronic medical records that the doctor has used. So we're able to access that, right? That notes that the doctor has prescribed or has documented better, and able to see what conversations went on between the physician and their patients, right? and able to participate in the care of that patient. Then finally, we have something called medication reviews or med checks, right? Where a pharmacist would sit down with the patient and go over all their medicines, not just the one that was recently prescribed, but basically go over all their medicines in order to see if there's anything that is offside, right, between the new medication that was prescribed and the existing medications that have been there, and see if there's any issues there as well, to see if we can help. So these are med checks is something where we sit down and go over a variety of things, including what can you do. For example, again, talking about that edema, or sorry, the swelling in the ankles, we talk about putting a pillow, for example, under the feet and raising your feet, right? If there's an injury, for example, we look at syndromes like RICE, for example, rest, ice, compress, and elevate, right? So things of that nature, where we go over things and see if we're able to provide some service as far as medication therapy is concerned. Now we go on to the next slide. How do we make medication simpler, right? So here's something else that comes up. A variety of times, if the regimen, I draw your attention to the previous slides where we said one of the reasons for non-adhering was it's too complicated, right? The regimen is too complicated. Sometimes we encounter this in cancer chemotherapy. A lot of the regimens for chemo are oral meds now, and they're out in the community. So the advancements in immune therapy and cancer regimens, they have moved over to the community. So community pharmacists are able to look at this and see, does it interfere, right? You got things like prednisone or steroids that are being prescribed on a sliding scale, right? And let's say a new start on an insulin where somebody was never on insulin, but they had taken oral medicines to control their diabetes, but they determine in concert with their physician that they're not able to control their sugars with the oral medicine. So now they need insulin start. So a pharmacist would come in and design a program for them in concert with their physician to see what can we do. When is the best time to dose that insulin? What is the best injection technique? How do we help you with that? What about weight? And so there are some things, newer things, where you can not only control your blood sugars, but also benefit from the weight loss that comes with some of these. These are exciting new medications that are available right now that allow you to not only do that, control your sugars, but also improve on weight loss, right? And then we talk about something called de-prescribing. What is this de-prescribing? I'm somebody that's actually very passionate about de-prescribing. De-prescribing is something I learned in the hospital where somebody looks at let's say a patient is on 10 different medications. Now we'll sit down and look at all those 10 medications to see, is there medication, what we call medication interactions between those medications, to see if they're interfering with one another. For example, some antibiotics will interfere with dairy products, right? So you want to make sure they're spacing. The calcium from the dairy will form a bond, if you would, with the antibiotics and inhibit the absorption of the antibiotic, right? So here's de-prescribing. One example I can give you is there's medications that are used for pain management. They're actually antidepressants. And the older antidepressants, we call them tertiary, right? They are full of side effects. In my opinion, they actually should not be prescribed, but there are still physicians that feel that there's a need in therapy for these medications that were discovered as an antidepressant, but they are used for chronic pain management. But then a lot of them have, one of the side effects they have is dizziness or drowsiness. We call them anticholinergic side effects, but basically, they make you dizzy, they make you thirsty, right? They cause what's called urinary retention. I remember one time I was in the hospital, somebody was coming in and they were going to have a surgery for urinary retention. but nobody had bothered to look at the medications that they were on to see, was there any medication there that was causing urinary retention? And guess what? When we looked at it, the pharmacist will, working in a hospital, will also visit patients that are admitted in the wards, as you know, right? And look over their medication. Sometimes they'll do it silently at the ward with the nurse or the physician or the nurse practitioner or the PA, and go over it, and may not necessarily see the patient, but that pharmacist in the hospital will also be looking at that regimen to see if there's something. So here's an example of de-prescribing. We actually, just for the sake of it, right, we actually make less money when we de-prescribe, right? But imagine the goodwill that we create, right? So that's something that we see with de-prescribing. Then we go to the next slide. Role of pharmacists in driving medication adherence. So here are different programs that are available that a pharmacist can help. Now, I'm going to talk about, a lot of these are self-explanatory, right? You can understand them. But there's one, like, for example, smart cards. These are not readily available, but there are companies out there, they've got compassionate programs, right? Where, let's say, a new regimen or new drug for immune therapy, for cancer therapy, right, is not fully covered, or there is a time where it takes before there is a submission that is sent out to the person's insurance, and it takes time to get the insurance to approve that. So the companies create compassionate programs. They create these smart cards, or basically they assist in a bridge program, if you would, to provide these things. Or if the insurance only covers 70%, they may cover the remaining 30% and allow for that therapy to continue. So these are various programs. Another program that a lot of people don't know is the Trillium Program. I apologize for folks that are not in Ontario, but the Trillium Program in Ontario, I imagine there would be similar programs elsewhere, but the Trillium Program in Ontario, you may be somebody that's middle income and you're not 65 yet, so you don't qualify for the seniors program. You're not under 25, so you don't qualify for that. You're in the middle, but God forbid you run into a program or a situation where you need medications that are expensive. Now here comes the safety net with the province of Ontario, and you're able to sign up for something like the Trillium Program. And as pharmacists, we constantly are able to do that. Next slide, please. So the role of pharmacists in driving medication adherence, these are some of the things that we use. These are compliance packaging, where, we remember back to that slide where we said, I can't remember to take my medicines. So here's something where we create a compliance program, and, their morning, afternoon, lunch, dinner, right? So these are some of the programs. Next slide, please. And this is again, with less wastage, if you would, less carbon print. So these are reusable compliance packaging. Next slide, please. And then once again, these are on the vials. I saw something in the US where you can actually write on the vial the morning dose taken, afternoon, and there's timers as well. So these are some of the newer technology. Then I'm going to go to the next slide, right? And again, there's apps here, right? Medisay app. So I'm going to, so I can stop talking and you can listen to somebody. So the next one is actually a video that I've put together for you for this app that's free. Anybody can download it. There's no money here. So please, Shabir, if you would, or Shazia, play that video for us.
I don't know if Nazmul has access to it. I don't, so I can't. I think somebody's, yeah, Shazia is playing. Okay.
Yeah.
I wonder if you're like me when it comes time to take pills. I take vitamins every morning, but I routinely forget about doing it. Imagine if you need to take multiple pills. Wouldn't it be great if there's some way to remind me the number of pills that I need to take? Well, in fact, there's a free app to do that. It's called Medisay. Let me show you this app. What it does is it divides the day into 4 quadrants: morning, noon, evening, and overnights. And then it distributes your pills all through those different quadrants. It also shows you what time you need to take certain pills, and it will give you an alarm to let you know that you need to take that pill. Adding medication is very simple. You just need to enter the name, the number of times that you take the pill, and also you can enter the color of the pill. In this case, a yellow oval-shaped pill. And if you want, you can also enter which doctor prescribed you that pill. By doing that, it'll put the pill into the 4 quadrants. When it comes time for people to say what color pills you're taking, you can easily point to, for example, this yellow and red capsule, identifying the pill and say, this is the pill that I'm taking, as opposed to saying, I take the yellow-blue pill. This app also tells you what pills you may have missed over a 24-hour period, so you can make it up if necessary. And also, it shows you a list of all the medications you're taking. So if you're seeking medical help, you can use this, show the medical doctor or nurse the medication you're taking. It helps us to help you better. So this app, Medisay, is a free app. You can download into Apple platform or Android platform. It's free. Let me know what you think. Try it out. And I look forward to hearing from you. Thank you very much.
Thank you. So Shabir, if we can go to the next slide. So one slide after. So basically, so that was something that's available. Here's something that's a little more sophisticated. This is called QPath. This is a company out of Vancouver, and this is more for the peace of mind of caregivers. Let's say if I have a mom or dad that's living all by themselves, and I want to make sure that mom and dad are okay. So this is another program where there's a 24/7 monitoring. So this packaging actually becomes smart. So you see the little QPath symbol up top, and there's somebody monitoring. So if mom or dad takes their lunch medication, the person monitoring is aware that medication was taken and everything's cool. Now, should there be a situation where there's a miss, so now the caregiver gets an alert, and that's how things go back, and hopefully we fix that. I'm going to go to the next slide, and that's again a little video I've prepared for you, Shazia, if you would.
Did you know that an estimated 285,000 deaths in Europe each year could be prevented if people took their medications as prescribed? Your doctor prescribes medication to help control your risk factors. Taking your medication exactly as the doctor prescribed, it helps maintain a steady state of control. Here are 5 easy tips and tricks for you. Keep an up-to-date list of your medication information. Use pillboxes and leave them in a place where you'll see them often. Use apps to remind you to take your medication the way you should. Ask your doctor for a simplified schedule and tie your medication doses with a daily activity. Don't hesitate to ask for help. Medicine works best when taken as prescribed. Find the trick that helps you take it.
So with that video, I hope to put together like the summary as to what medication adherence is, taking your medications as you discussed with your physician, and with the help of your pharmacist, hopefully you're able to continue that regimen, monitor it, and then look for any side effects and tailor it according to each individual circumstance, right? So that video allows me to now put this nice bow on this presentation, and that's basically what I intended to present to you. And those 5 tips there in that video are a little, if you remember anything from this presentation today, look at that little video, and I hope that helps. In the interest of time, the last subject I wanted to talk about before I invite any questions is medical marijuana. So next slide, please. So medical marijuana, as we all know, has been legalized in Canada, right? It's available with there's an initial consultation, and so there's basically 2 components. Next slide, please. That we see. One is THC, all right? It's got that long fancy name, but forget about that. The THC is an easy name, right? And CBD. The THC part, that's what makes you feel good, basically, right? So in simple words, that's what causes euphoria. That's something that creates that feeling of euphoria or makes you feel better or good, if you would. CBD, that's got it doesn't affect the central nervous system, right? So that's what's used, and we have studies that show it's help with pain, it's help with inflammation, with nausea, with seizures, right? So there's a variety of studies that have actually been done that with CBD that we see. Like lately, I've seen a study where as a seizure medication in kids in the U.S. and there is some positive results there. But of course, like everything else, there are side effects. There's more studies to come. It has been around for nausea, as you know, in chemotherapy, right, for the longest time. Next slide, please. So right now, when we look at the things that medical marijuana has been used in, as we discussed, right, pain. I see this a lot day in, day out in the management of pain in adults, right? We see quite a bit of use in that area. And cancer pain, that's something that a lot of folks are going through. MS, seizures we talked about, and finally nausea and vomiting we talked about. That's something that has been there for the longest time and has been used for the longest time. Finally, we go to the last slide here as far as how is it available, second from last, if you would, the different ways that it's available in. It's available as a capsule, as a spray, as an oil. Of course, I'm not a big fan of vaporization, but we see these are the different forms that are available right now. And there's my resource at the bottom from U of T library. So these are some of the things that we see that are available. And so I just wanted to give you a little brief teaser on medical marijuana, just to make sure that that's something that a pharmacist can do. So a lot of times what this happens is, like I've been approached by patients that are saying, I need to do this for this, and that. And so we'll do an assessment, make sure that they meet the criteria, and then there's discussion with their physician, or there are physicians that specialize in medical marijuana on the different conditions. And then that prescription usually is sent to a licensed producer, and then that prescription then goes from that licensed producer to the patient, right? We pharmacists right now are not directly dispensing this, right? It's sent to a licensed producer, and that's how that system works. And finally, with the last slide here, I thank you for being here with me today. I apologize. This is the 15th of Shaban. If I've said something that is not accurate, or it's something that needs further clarification, we're happy to sidebar and take the questions now or later. But once again, I thank you for being here, and I hope that you will remember all of us in your du'as tonight. With that, I end my presentation, and I invite questions for the remaining few minutes that we have.
Please put your questions in the chat, or feel free to raise your hand, and we'll get you on screen. Thank you. While we are waiting, can you shed some light on the expiration dates people say that, you know, this is the best buy date kind of thing or whatever. Do you have any thoughts on that?
Yes, so that's something that we encounter all the time. As a pharmacist, I cannot ask somebody to take something that is expired, but just because something expires, as far as medicines go, a lot of them, for example, that doesn't mean that they become poison the next day, right? It's just that their efficacy may go down a touch, right? From 100% to 99, 98, 97%. So here in North America, our guidelines are very, very stringent as far as expiry dates go. But then we need to look at the actual situation, the actual medication and whatnot, and then decide for ourselves what, or discuss with your pharmacist or your physician to see if what can be done about that, right?
Shabir, do you want to cover the chats?
Okay, so I see in the chat there's
Sorry. I was muted. My apologies. Okay, can you hear me now?
Yep.
Yeah. Okay, so there's a question on chat is, in addition to medication, what are 3 key food and lifestyle things one can do to lower cholesterol? Would you be able to talk on that one, Akil?
Sure. So, you know, before I did this, one of the things I did was, in preparing for this chat, right, I looked at a video of Dr. Mohsin Jaffer, right? Some of you may know him from Florida, right? He's based in Miami area. And he talks about secrets of living a long life, right? So there's a lot of, so if you would, you can Google that YouTube video, Atia. There is a ton of information there that talks about the different things you can do to maintain a healthy lifestyle. And he looked at people from Tibet, for example, people in the Mediterranean diet, for example. So a lot of these things that can be done. He talks about 10,000 footsteps, right, a day, a pedometer. Some of the things you can do: decrease red meat, right? Walnuts, for example, have been known to help with that. But a lot of times also, I'll caution you that if it's what we call familial hypercholesterolemia, which is basically, in simple English, the high cholesterol is as a result of family history, or I'm going to change it further. We as Asians, our blood vessels are narrow to begin with. South Asians, I have cardiovascular friends who have talked about our blood vessels being narrow to begin with. So we're dealing with a lot of things. But I invite you to look at that video. In the interest of time, again, it talks about secrets to a long life from Dr. Jaffer, Mohsin Jaffer in Miami, and he answers this question in length, and he looks at a variety of different things. He talks about not letting dead animals be our stomach be the graveyards of dead animals. So in simple language, look at the amount of meat you're consuming, right? So hopefully I answered that.
Okay, I think I see one more. What services do pharmacists provide besides just meds?
So that's another good question. So right now, in the beginning of the conversation, we talked about expanding the scope of pharmacists. So we as pharmacists have been lobbying the federal government for a number of years that here we are, medication experts, we're available, we're readily available. In the last year, you look at a lot of physicians were not available. Guess who answered the questions? We're always there. You can, I challenge you, call your pharmacy and ask to speak to your pharmacist. They'll speak to you. They'll actually speak to you. They won't ask for a retainer like my cousin would, but they'll actually speak to you, right? So here's a profession that has been lobbying for it. And one of the latest examples I can give you, which Shabir alluded to, is we were actually one of the first pharmacists, independent pharmacists, chosen to do COVID-19 testing in a community setting. Right now, we're also in the pilot, one of the top 300 pharmacies that's involved with vaccinating Ontarians in Scarborough or in the Toronto region. So here are two examples of things that pharmacists are doing right now. If we went to the province of Alberta, pharmacists can also prescribe for minor ailments, so minor problems like urinary tract infection, etc. So these are some of the minor things that pharmacists can participate in, are participating in. If I go to the UK, where I have my daughter studying pharmacy, I see similar things. A lot of our things are coming from the UK, so we see these things.
All right, I think I can see Kaniz Kimji has raised a hand, so I don't know who's talking there, but go ahead.
Hello, Assalamu alaikum, Akil bhai.
Walaikum salam.
Thank you so much for a very interesting, very informative, excellent presentation. Thank you so much. I just have a question about the vaccinations, but before I do that, you know, you pharmacists should be given dual degrees, because we get more information from pharmacists than the doctors themselves. Doctors, if there's anything complicated, they'll just send you to a specialist and they give you medication. They don't give you too much explanations. Sorry, doctors, if you're listening, but that's the story. I guess they don't have time. They have 10 patients waiting outside. But we get more information from you guys than other places. So my question on the vaccination is, you know, lots of our people, I don't know about the others, but they're about 60 and less than 70. They're not making appointments for vaccinations because they don't want AstraZeneca. They want Pfizer. If somebody wants Pfizer, would you be able to do that, or you just give AstraZeneca?
Yes, thank you for a question. I appreciate your comments and confidence. So again, I prepared for this also as somebody that's piloting this program in the province of Ontario. So I'm not sure, Nazmul, do I have your permission to play that? I anticipated this question, so that
Yes.
time, or are we out of time, Nazmul? But I think,
No, we can do that. Can you stay on after 3 o'clock?
yes, sir, I can. But I think that video is amazing to answer this question.
Wonderful. Let's watch that. Now, I should at this stage also thank my granddaughter, Sabah Fatima, who's been helping me out. Granddad is not that tech savvy. He can switch on the computer and switch it off, but beyond that, he's stuck. So she comes to the rescue. So Sabah Fatima, the vaccination video, please. YouTube clip.
1 second, there's an ad.
Thank you for your help.
Michigan. But the mayor said, this is the new one-dose COVID-19 vaccine from Johnson & Johnson. In early March, more than 6,000 doses were supposed to be shipped to the city of Detroit, Michigan. But the mayor said, no thanks.
Moderna and Pfizer are the best, and I am going to do everything I can to make sure the residents of the city of Detroit get the best.
He was referring to these numbers, the vaccine's efficacy rates. The vaccines from Pfizer-BioNTech and Moderna have super high efficacy rates, 95 and 94%. But Johnson & Johnson, just 66. And if you only look at these numbers, it's natural to think that these vaccines are worse than these. But that assumption is wrong. These numbers are arguably not even the most important measure of how effective these vaccines are. To understand what is, you first have to understand what vaccines are even supposed to do. A vaccine's efficacy rate is calculated in large clinical trials, when the vaccine is tested on tens of thousands of people. Those people are broken into two groups. Half get the vaccine and half get a placebo. Then they're sent out to live their lives while scientists monitor whether or not they get COVID-19 over several months. In the trial for Pfizer-BioNTech, for example, there were 43,000 participants. In the end, 170 people were infected with COVID-19. And how those people fall into each of these groups determines a vaccine's efficacy. If the 170 were evenly split, that would mean you're just as likely to get sick with the vaccine as without it. So it would have a 0% efficacy. If all 170 were in the placebo group and 0 people who got the vaccine were sick, the vaccine would have an efficacy of 100%. With this particular trial, there were 162 in the placebo group and just 8 in the vaccine group. It means those who had the vaccine were 95% less likely to get COVID-19. The vaccine had a 95% efficacy. Now, this doesn't mean if 100 people are vaccinated, 5 of them will get sick. Instead, that 95% number applies to the individual. So each vaccinated person is 95% less likely than a person without a vaccine to get sick each time they're exposed to COVID-19. And every vaccine's efficacy rate is calculated in the same way. But each vaccine's trial might be done in very different circumstances.
So one of the biggest considerations here when we look at these numbers is the timing in which these clinical trials were performed.
This is the number of daily COVID-19 cases in the US since the pandemic began. The Moderna trial was done completely in the US, here in the summer. The Pfizer-BioNTech trial was primarily based in the US too, and at the same time. Johnson & Johnson, however, held their US trial at this time, when there were more opportunities for participants to be exposed to infections. And most of their trial took place in other countries, primarily South Africa and Brazil. And in these other countries, not only were case rates high, but the virus itself was different. The trials took place as variants of COVID-19 emerged and became dominant infections in these countries, variants that are more likely to get participants sick. In South Africa, most of the cases in the Johnson & Johnson trial were that of the variant, not the original strain that was in the US over the summer. And despite that, it still significantly reduced infections.
If you're trying to make one-to-one head-to-head comparisons between vaccines, they need to have been studied in the same trial with the same inclusion criteria in the same parts of the world at the same time.
If we were to take Pfizer and Moderna's vaccine and redo their clinical trial at the same time that we did J&J's clinical trial, we might see quite different efficacy numbers for those.
These efficacy numbers really just tell you what happened in each vaccine's trial, not exactly what will happen in the real world. But many experts argue this isn't even the best number to judge a vaccine by anyway, because preventing any infection at all is not always the point of a vaccine.
The goal of a vaccine program for COVID-19 is not necessarily to get to COVID-0, but it's to tame this virus, to defang it, to remove its ability to cause serious disease, hospitalization, and death.
It helps to look at the different outcomes of an exposure to COVID-19 like this. The best case scenario is you don't get sick at all. The worst case is death. In between, there's being hospitalized, severe to moderate symptoms, or having no symptoms at all. In the absolute best circumstances, vaccines give you protection all the way to here. But realistically, that isn't the main objective of COVID-19 vaccines. The real purpose is to give your body enough protection to cover these possibilities. So if you do get an infection, it feels more like a cold than something you'd be hospitalized for. And this is one thing that every one of these COVID-19 vaccines do well. In all these trials, while some people in the placebo groups were hospitalized or even died from COVID-19, not one fully vaccinated person in any of these trials was hospitalized or died from COVID-19.
One thing that I wish that Mary would have understood was that all 3 vaccines have essentially 100% effectiveness in protecting from death.
The mayor of Detroit did backtrack and said he'd start taking Johnson & Johnson doses because it's still highly effective against what we care about most. Efficacy matters, but it doesn't matter the most. The question isn't which vaccine will protect you from any COVID infection, but which one will keep you alive or out of the hospital? Which one will help end the pandemic? And that's any of them.
The best vaccine right now for you is the one that you're offered.
With each shot that goes in someone's arm, we get closer to the end of this pandemic.
So, Kanizbai, I get this question on a daily basis as being one of the pilot pharmacists. So I knew I had to do this today, and somehow I'm sure we planned this, right? So this question and this video was all pre-planned, right? Just a joke. But somehow I anticipated that this being the times we're in, that this would come up. And again, I deal with it on a daily basis. So I scoured our literature, and this was the best explanation I could come up with. I didn't know how to say all that in that beautiful a manner, but basically it allows us to stay out of the hospital, prevents death. And if we, God forbid, if we get that infection, even that AstraZeneca, even the Johnson & Johnson allows us enough protection so the body can deal with it, and it keeps it from being a serious event. It just feels like a cold, and our body is able to deal with it. With that, I hope I've answered your question.
Thank you very much, Akil bhai.
Excellent, excellent. Can I ask my question, Shabir?
Yeah, please do.
Okay, thank you. There is this view out there, Akil, that the big pharmas produce all these medications, things, water. They go and see the doctors and, get them to start prescribing. They are in cahoots with the doctors and the pharmacists. You must hear that too. So how would you educate the people that it's that's not really the case?
Yes. So again, all of us have colleges that we belong to and ethics that we live by, and a program that we have been through in order to. So very few of us would actually risk all that time that we've invested to deal with it. But I'll answer it to. If we say that these things don't work or what have you, I'm somebody that just buried my mom in Dar es Salaam, right? And for COVID, and as we all know, there was somebody there that said there is no COVID there. I remember landing in Dar es Salaam, and they said, remove your mask and remove your face shields because we don't have this problem going into the hospital. We don't need PPE because we don't have it here. There's some. So you have all these theories that unfortunately they proliferate in the dark web, right? And unfortunately they propagate and get some growth and come out and these things. But you look at Brazil right now. You have somebody there, for example, that's denying it. 2,000-3,000 deaths a day right now due to COVID, right? That there is no such thing as COVID. So basically, I look at the example of the advances in cancer immune therapy, right, Nazmul? Right? The examples are, the advancements are immense, right? The benefits. I have a brother who's benefited from immune therapy, right? From severe carcinoma of the lungs, right? To where. So I look at that and I say, oh my goodness. And yet there's people that think there's a conspiracy theory. Come on now. I've given you two real life examples in my own family. And it's more like I pointed to you as well, right? And you see the benefits have been tremendous, right? In advancements in science and what we've been able to achieve. Is there bad apples? 100%. Is there folks that prescribe to things that there's a pill for every ill? 100%. But you hope that good outweighs the bad.
Excellent. Thank you for that excellent explanation. Thank you. Do we have any more questions or comments? Any more raised hands? Anything in the chat?
I just have a comment. Actually, Akil, amazing, very good presentation. Very appropriate for the time, for the age group, and for the participants. Thank you very much.
My pleasure. Thank you for inviting me.
Yeah, Akil, well done. Very well, obviously prepared well, and you do this for a living too. I know that you do a lot of presentations. So we had the benefit of you doing this presentation for us, which we really appreciate. Thank you again. Thank you.
Thank you for inviting.
our audience, next week, we are taking a break. There is no program. So we'll see you back in 2 weeks. Sorry to let you down, but 2 weeks on, we'll see you, and the notice will go out in due course. You take care. Bye-bye.